Welcome back to my channel. Today's topic is syphilis. We are starting with another bacteria, that is Treponema pallidum, which is causing syphilis. So syphilis is a chronic condition produced by Treponema pallidum. The morphology of the bacteria is that it is gram-negative, motile and microaerophilic spirochete. So spirochete is something like this. Okay, it is characterized by episodes of active disease periods and periods of latency, like how the TB that we read goes in a dormant stage, like that Treponema pallidum also goes in the periods of latency. Now coming to the pathogenesis, the route of transmission is through sexual contact and congenital is via birth. So first is the vernal or the sexual contact, and second is your congenital. Now Treponema pallidum penetrates through small breaks in the skin. Okay, it penetrates through small breaks in the skin, and it initially attaches to specific attachment ligands, then invades its ability to penetrate into the endothelial cell layer. Now the intracutaneous inoculation occurs after it penetrates in the endothelial cell layers, then appears after minutes in the lymph nodes and disseminates widely in short time. Now then after which it incubates for a period of 3 to 90 days and produces primary lesions. Coming to acquired syphilis, transmission of the acquired syphilis is primarily transmitted through vernal contact and congenitally, also by direct contact and blood transfusion. Now the disease is, if left untreated, occurring in three stages: your primary stage, secondary stage and tertiary stage. So what is the first stage? That is the primary stage, which is characterized by development at the site of inoculation, and clinically it takes 3 to 90 days to expose after exposure to develop, and it is usually solitary. It is elevated and ulcerated nodule with local indurations. It is covered by thick exudate which is rich in spirochetes, that is your Treponema pallidum, and commonly it occurs in the penis areas of male, cervix or uvula of the females, and anal canal or rectum. It can also inoculate near lips, mouth, tongue, palate, gingiva. Lesions on the lips are usually brownish and crusted in appearance. Now the intraoral cancer. What is an intraoral cancer? It is an ulcerated lesion covered by your grayish white membrane. So it is an intraoral lesion which is covered with a membrane, that is your whitish gray membrane, and this can be painful. The intraoral cancer could be painful due to secondary infections. Very rarely it appears as pyogenic granuloma also at times. Okay, so first is its primary stage. In primary stage it occurs in 3 to 90 days. It starts showing solitary lesion, then after which the nodule is elevated, usually painless in the initial days. The ulcerated lesion is covered with a exudate which is rich in spirochetes, and then it also occurs near the mouth, lips and the genitals of males and females, and also the anal canal. Okay, after this there is something that occurs in the primary stage, is the intraoral cancer. Okay, intraoral cancer is the ulcerated lesion covered with grayish membrane which is a bit painful, and this is due to secondary infection, and it rarely appears like pyogenic granuloma. Now coming to regional lymphadenopathy with your primary features, regional lymphadenopathy is an accompanying feature. Now the cancer heals spontaneously. Microscopically, the cancer appears as a superficial ulcer showing intense inflammatory infiltrate. Not every patient with primary syphilis exhibits positive serological testing. Okay, so if a person with primary syphilis tests himself or herself, might not show a positive result. Okay, then the cancer, which is the primary cancer, it heals spontaneously in 3 weeks to 2 months. Then after which there is formation of secondary syphilis. So this cancer, when viewed microscopically, appears as a superficial ulcer showing intense inflammation and plasma cells, microorganisms demonstrated by silver stain. Now, coming to secondary syphilis, it usually develops 6 to 12 weeks after the primary lesion. The skin and the mucous membrane are commonly affected, and the skin and the mucous membrane, which are commonly affected, show lesion. The lesion could be multiple or involve the trunk, face, extremities, result in pink to red macules or papules. Okay, so first is your primary lesion, the cancer is forming, then this cancer heals, then there is a formation of secondary lesion, that is usually after 6 to 12 weeks of the primary lesion. Then that is affected with multiple lesions occur, and it involves face, trunk, extremities. Systemic symptoms are painless lymphadenopathy, sore throat, malaise, headache, weight loss, fever, and musculoskeletal pain. On skin, the diffuse, painless, non-itchy maculopapular cutaneous rash is seen, and on oral cavity, the oral ulcer is called mucus patches. The oral ulcer, like how it was called primary, in primary it was occurring in the mucous membrane initially. Now that which is occurring in secondary is called mucus patches. These patches are multiple patches, painless and grayish white patches, which occur on the tongue and the gingiva as well. Now they are ovoid in shape, surrounded by erytheromatous zone. Coming to condylomata lata. Condylomata lata is a mucocutaneous papule which coalesces to form a large pink gray lesion, which is warm and moist areas, which occurs in warm and moist areas such as uvula or scrotum, which is the direct infiltration of pathogens occur in this area, and it is called condylomata lata, which is a papule which is coalescing. So basically small papules coalesce to form a large pink lesion, that is only your condylomata lata. Okay, now the lesion of the secondary stage undergoes spontaneous remission, that is it heals after uh, 3 to 12 weeks, and continuously exacerbation continues to occur for months or years. Now coming to Lues maligna, an explosive widespread of the primary syphilis characterized by fever, headache, necrotic ulcerations of the face and scalp is Lues maligna, which is this malignant type or the widespread of the secondary syphilis. Serological reaction is always positive in this stage. Then coming to the latent stage, where the syphilis after the secondary stage is free from symptoms, and this is the latent stage where the basically firstly initial cancer occurs, then there is a formation of your primary lesion, then the primary lesion forms secondary lesions, and there are high symptoms, fever, sometimes it can cause maligna, widespread, after which there is a fall in the graph of syphilis, which is your latent stage, where your syphilis bacteria, that is your Treponema pallidum, are going into a latent stage. It could last from 1 to 30 years. Okay, this tertiary syphilis stage includes serious complications such as serious complications, that is your aneurysm of aorta, left ventricular hypertrophy, vascular symptoms, CNS paralysis, psychosis, dementia. Gamma is the classic. So like how initial cancer is the characteristic lesion of the primary, then there is a secondary lesion. Gamma is the tertiary lesion of the tertiary syphilis. This tertiary lesion occurs due to hypersensitivity reaction between the host and the treponema. Okay, the site on which it occurs is skin, mucous membrane, liver, testis, bone. Okay, it consists of a focal so basically gamma is a classic lesion. It is a type of hypersensitivity reaction between the bacteria and the host. Okay, moving forward is gamma is the tertiary lesion of the tertiary syphilis. It is occurring due to an hypersensitivity reaction, and treponemas break down the products in this lesion. It occurs in the skin, mucous membrane, liver, testis, bone, and it consists of focal granulomatous inflammation, and it appears nodular indurated lesion. Oral manifestations is it can also occur intraorally, and it most commonly involves the tongue or the palate. In the palate, the ulceration frequently perforates through the nasal cavity. The intestinal glossitis is a feature which is involving the tongue, and there is diffused appearance of largely lobulated irregular shaped gummata. Okay, so basically the gamma occurring on the tongue is called interstitial glossitis, and gamma is a hypersensitivity reaction, and it occurs mainly in the tertiary syphilis. It occurs on the skin, mucous membrane, it is nodular indurated, and it is having an oral manifestation, that is the intraoral gamma, which occurs in the palate. And in the interstitial glossitis, that is something that is involving the tongue. Okay, now there is something called as leutic glossitis, syphilitic glossitis. Syphilitic glossitis is occurring on the surface of the tongue, and leutic glossitis is occurring on, it causes the atrophy of the tongue papillae. Now coming to the congenital syphilis, or the last type of syphilis. Congenital syphilis is transmitted from the offspring to the from the mother to the offspring, and that is only possible if the mother is infected. So there are many manifestations seen in the congenital type of syphilis, in which Hutchinson's triad is the most asked type of trait. So Hutchinson's triad is where there is Hutchinson's teeth is seen, and then there is interstitial keratosis and eighth nerve deafness. Okay, it is a pathognomic diagnostic feature found in congenital syphilis, your Hutchinson's triad. Okay, so basically in Hutchinson's triad you have something which is Hutchinson's teeth. So what is Hutchinson's teeth? Is its anterior teeth in the Hutchinson's incisors exhibit the largest mesiodistal width in the middle third. So like how a normal person's mesiodistal width is in the incisal third, but in these incisors it is in the middle third of the crown, not in the incisal third. The incisal third tapers towards the incisal edge, resulting in a straightened edge or screwdriver shaped, like this. Okay, screwdriver shaped incisal edge. Now coming to the posterior teeth. Posterior teeth have a appearance of mulberry or mulberry molar, Moon's molar, or Frownier's molar. Mulberry molar is tapered towards the occlusal surface, meaning the occlusal surface is smaller, and it is constricted surface, and the occlusal anatomy is abnormal. Obviously, numerous disorganized lobular projections resemble the surface of a mulberry molar. Now, the outer interstitial keratosis is not present at birth, but it develops at the age of 5 to 25. Affected eye is opacified, and the resultant is loss of vision. A number of other ulcerations are saddled nose, high arched palate, mental retardation, gammas, and neurosyphilis. Now the diagnosis. Diagnosis is, it is a dark field microscopy examining the exudates of active lesion. Care should be taken to eliminate salivary contamination, otherwise it gives a false positive result in the dark field microscopy. Then specific tests are done, that is your highly sensitive serological fluorescent treponema and deep. So basically there are a diagnostic test, that is your specific and highly sensitive serological test fluorescent treponemal antibody absorption, and treponema hemagglutination assay. Treatment is your penicillin and erythromycin tetracycline. If patient is allergic to penicillin, then erythromycin or tetracycline is given. Surgical correction of the facial defects can be done, and there is something called Jarrison-Hermax reaction, which is an initial response to the therapy, which occurs secondary to the release of endotoxins when the antibiotics kill the large number of microorganisms. This reaction is triggering, and then this is the reaction to the therapy. It occurs about 8 hours after the first infection of penicillin. Mild fever, malaise, headache, everything occurs, and signs are temporary. They fade rapidly. Thank you for watching. My next video will be on scarlet fever, and hopefully I'll cover Noma as well. So that's the important bacteria for bacterial infection. Stay tuned for my last video. Thank you for watching. Follow for more. Bye.